Dr. Nguyen, I'm sure you have heard that sleep apnea is lately a very, very big story in the medical field overall. Apparently, way more people have sleep apnea than anybody ever expected, meaning they don't sleep through the night, and meaning they wake up because of snoring or not. In fact, most people, not all, but most people who have sleep apnea seem to be also snoring, or worse versa, whichever way that goes. So in any case, they wake up 50, 60, 100 times an hour, don't even know it. And then in the afternoon, late afternoon, they get groggy. They pass out. They go poof, and get very low energy, which is quite often then they go for the coffee, the Red Bull, the Coca-Cola, the energy drink, and all that stuff. There's data out there that there's more people currently, they find out more people having heavy fatal car accidents because of sleep apnea than because of drunk driving. Pretty bad statistic. In New Jersey, a bus driver just a couple, 2, 3, 4 months ago wrapped the bus around a ball, killed people in it, and they only suspect sleep apnea. So tremendous amount of people seem to be having it, and dentists seem to be one of the best, not the only one, but one of the best people to help that out in the most inexpensive way by simply putting a mouth guard on it. Can you shed some light on this?
Yes, definitely. Yeah, and that has become a pretty big concern, if I should say, lately that they found out a lot more about it, than before, and then they found out a lot more people having that problem. And it just simply, like an obstruction, like you can't really get enough air in. And there you go, there are a lot more problems just happening from there. And basically the occlusal guard, or the night guard, what we call it, it just try to open the airway up. That's all that it does. It's,
it kind of pushes,
so
it pushes the front, the lower one a little forward, and by doing so the air can go
right, they just kind of reposition the jaw a little bit better to open the airway so that way you can get enough air in there. And that seems to be solving or helping tremendously.
Right. Well, I mean, look what you just said. I mean, the air is blocked. Because of it, the patient starts waking up because the natural system, something, we have a very big survival system built in our bodies, kicks in. So he wakes up so that he does breathe. But by doing so, he woke up. And so now he's deprived of 2 things throughout that night. Oxygen.
Yes.
Pretty important. I mean, cannot live much more than 60 seconds without it, kind of, right? People like you and me probably even can't live that long without it. And sleep. We know that sleep deprivation goes into depression, goes into becoming very annoyed. It's a major problem. And both of them come with it because of it. Now, tell me a little bit. There is the golden standard of sleep apnea seems to be the CPAP machine, which is basically a compressor which presses air into the person's mouth, a big mask on it. Let me tell you a little story.
Right.
When I talked to doctors and I found out, I said, ooh, my wife has sleep apnea. And I didn't say that only because she snores. I kind of heard her stopping breathing sometimes. She went for a CPAP machine. And my wife is the most disciplined person you can have. When she does something and it feels healthy, she just will do it, right? Not me, but she will. But that CPAP machine was too much for her. Never mind for me, because you know what? This morning, at least I knew my lovely wife is happy. She's snoring. You think people are very happy when they snore. You know what I mean? I don't know. I did. You know what I mean? So, and by the way, I snore too. I mean, she tells me so. But the point is, but that machine, that made a noise, that was unnatural. That wasn't my lovely wife making noise. That's fine. You know what I mean? That was unnatural. So the point is, we went to a dentist and put that thing on. And some people say it's not quite as good as the CPAP machine. Let's say they're right. Here's what a sports teacher once told me when I asked him which exercise is the best. He looked at me and he said, Helmut, it's the one you will be doing. Because obviously we most of us have problem exercising. So if there's something you're willing to do, that would be the exercise for you. Same with this machine. You know, the nerve guard, that one she wears. You know, if right before dosing off, she says, honey, and she turns around, she puts it on, and she can turn. And she can travel with it. I mean, sure, she can bring that machine, the CPAP machine, with her too on an airplane. But you know, I mean, you have a little lady, you know, no, that thing is easy to travel because you need to wear it every day. Because when you have sleep apnea, the fact that you, it's like with glasses. You see or you don't see. You put glasses on, you see. You take them off, you don't see. You wear the sleep apnea machine, whether it's the CPAP machine which pushes air in it or the dental appliance, next day you'll be fine. You don't wear it, next day you're not fine. So you need to take it with on trips and that type of stuff. Did you have any experience with patients similar to my wife?
Actually, I had quite a few that had, you know, sleep apnea problem, and they went through like extensive treatment, you know, all kind of thing. And then the CPAP machine, one of the patients told me that, it's, like you said, it's bulky, it's really big, and it hook up and it take, you know, like some learning for you to be able to get it done right.
Well, you need to sleep stiff on the back. I mean, because how with this thing and the hose coming away, and frankly, you know, I mean, my wife and me, we're not exactly 20 at 25 anymore. I got that, but still, your wife, you know, who you think is a healthy, vital person, all of a sudden wears such a mask to go to sleep. You go, oh, gee, what's happening? Are we over the hill?
You're right. That, and then it kind of, that's what he was kind of mentioning about, you know, like, he's have to have all of this heavy equipment around him and, you know, wearing the mask. And it makes, he said it's, it bothers his gum a little. And then like the mouth, because you have to hold that, piece in there. Oh, wow. For the whole night, pretty much. And, it's pretty powerful, like the air, like you said, the puff in and all the noise and all of that too. Obviously it helps, but I mean, if you can have something small, convenient, and it does about 80%, you know, of the job.
Absolutely.
That efficiency, then, you know, that would be good too.
Right. And it's a lot cheaper. And on top of it, my wife, sometimes a tiny bit, but I would say 95%, I don't know, I obviously don't measure it in terms of anything, but a huge amount, no snoring anymore.
That's good.
Now she tries to get me one to wear too. All right. Well, you have it. So dentist, it's amazing what you dentists are good for. I mean, you can get energy back in the afternoon and prevent car accidents because of sleep apnea, which in itself has other problems too with amnesia and stuff because brain oxygen deprivation and sleep deprivation. You can make people's headaches go away by doing DMJ treatment and those type of things. You always will make them looking good by putting beautiful veneers and lumineers and crowns on it. Anything you guys can't do? I mean, should we just eliminate the rest of the doctors and just, it's all in the mouth? Looks like lots of it is in there. Thank you very much.
All right. Thank you so much. I'm glad that we can help.
Sure can. Bye-bye. Sure can.